Thank you, Daniel. Thank you, everyone, for joining today to discuss the evolving clinical applications of Ozempic. The presentation is broken down into three main components. So we're going to start off with the overview of what exactly is Ozempic. Then we'll shift our focus into how it started to be used for weight loss, and then end our discussion talking about the overall management of obesity. So without further ado, let's begin. So what is Ozempic, also known as semaglutide? Well, it belongs to a family of medication known as glucagon-like peptide-1 receptor agonists. I know that's a really long word, but essentially what this means is that it mimics hormones within our body to act on three key main body sites. One, the pancreas. It's going to promote insulin secretion in a glucose-dependent manner. Secondly, if blood glucose levels are high, it will also lower glucagon secretion. It will also work on the stomach, delay gastric emptying, and it also will work on the brain to decrease appetite. As we can see, based on these three mechanisms of action, GLP-1 receptor agonists, such as Ozempic, is not insulin. So when was Ozempic into the Canadian market? Well, the story started in January 4th, 2018, when it was approved by Health Canada based on three primary findings. It improved blood glucose in adults with type 2 diabetes. It helped lower the risk of cardiovascular events such as heart attack and stroke. And it reduced the risk of worsening kidney disease and kidney failure. Based on these findings, Health Canada allowed the indication of Ozempic for the management of type 2 diabetes. This screen grab just shows the various indications of when Ozempic can be introduced into the management of type 2 diabetes. Although Ozempic is very effective for the management of type 2 diabetes, there are key safety information to keep in mind. Studies done on rodents, mice, and rats show that it increases the risk of thyroid cell tumors and can cause thyroid cell tumors in those animals. The human equivalency has not been solidified nor found, but symptoms to keep in mind of include lump or swelling of the neck and trouble swallowing. Based on these results, there are certain contraindications to keep in mind. The main two are if you have a personal family history of medullary thyroid carcinoma or multiple endocrine neoplasma syndrome type 2, which just refers to different types of tumors that can happen into the glands of our bodies. Common side effects based on the mechanism of action include gastrointestinal. So as we can reflect back onto the previous slide, it slows gastric emptying and also decreases appetite. So diarrhea, vomiting, nausea can be expected. But some serious side effects include pancreatitis, changes in vision, low blood sugar, and acute kidney injury, which require medical attention. These two figures demonstrate how the Ozempic pen looks like and the titration scheduling, as well as the site of administration. There are three different pens on the market. You first start off with a 0.25 milligram dose, which is not a therapeutic dose, and then gradually increase on 4-week increments. The figure on the right-hand side shows the administration site. It's a once-weekly subcutaneous injection that can be administered at the deltoids, so the shoulders, your stomach, as well as your thighs. And it's important to rotate sites and not to use the same site for injection. Now that we have covered the foundation, the overview of what exactly is Ozempic, how did this medication start off to be used for weight loss? So there were many different headlines and trends and social media reports regarding Ozempic. The New York Times posted, "What is Ozempic and why is it getting so much attention?" CBC, Canadian News, Global News, started reporting on shortage of Ozempic for the management of type 2 diabetes because many individuals were using it off-label to manage their weight. People also found changing in consumer patterns, increase in wearable devices, increase in fitness activities, fitness devices, as well as dietary patterns as well, and a deep social media buzz all over TikTok, Instagram, and social media. So when this was started to be reported, scientists started to look into more the weight loss benefits of Ozempic. And what was started was a semaglutide treatment effect in people with obesity program. So a series of 8 different studies within this STEP program that was conducted to look at the effect of Ozempic or semaglutide in different populations to see, can this medication actually be used for weight loss? The study here is step 1. The reason I'm highlighting this particular study is because it looked at individuals greater than 18 years old that either had a BMI 30 or more or a BMI 27 or more with one comorbidity such as high blood pressure. A key exclusion criteria was that it did not include anyone with diabetes. So this study, in summary, looked at patients without diabetes who had, based on WHO's definition, either obesity or overweight, followed along by either taking Ozempic once weekly or not taking Ozempic. Both groups, however, were followed along with lifestyle interventions such as counseling, diet, and physical activity over a period of 68 weeks. These are the results from the study. So the gray line is the placebo, so the group that did not receive Ozempic on a weekly basis. However, they did still receive lifestyle interventions. So we can see a modest decline in change from baseline in terms of weight. But that group that did receive Ozempic, in addition to the lifestyle modifications, we can see a drastic shift according to the beige colored line. It's important to note, though, that the effect in weight is not immediate. As you can see on the x-axis, it takes a few weeks to even months to see the changes in weight. So what did this study find? That the average weight loss was actually about 15% from baseline in the group that took Ozempic in addition to the lifestyle interventions. So based on this finding, as well as multiple other studies within the STEP program, Health Canada on November 11, 2021 approved Wegovy for the management of weight. This is the particular screen graph from Health Canada's website looking at the indications. As we can see, it mirrors exactly the population that was studied in the STEP program. So individuals with a BMI 30 or more, or a BMI of 27 or more with at least one comorbidity. The very last point is a unique point that I would like to mention. It also reduces the risk of non-fatal heart attack in adults with established cardiovascular disease and a BMI greater than or equal to 27. The reason I'm highlighting this last point is because this indication was just approved on November 2024, of just the end of last year. So it shows that Ozempic is constantly being studied for multiple different indications. Multiple studies are still being done, and as we're speaking right now, there are more indications being investigated. Another key point is that Ozempic, that's indicated for type 2 diabetes, is not indicated for the pediatric populations. However, Wegovy, which is indicated for chronic weight management, is indicated for ages 12 to 18 years old. The titration schedule mirrors exactly to the one from the STEP study that I showed in a few slides ago. So we'll start off with 0.25 milligrams, and then by increments increase to a therapeutic dose of either 1.7 milligrams or 2.4 milligrams. Because the medication is the same as Ozempic, the risk of thyroid cell tumors, the contraindications, the common side effects, and the serious side effects are going to be similar as well. So now we discuss what is Ozempic. We created the foundation, and we went over how this medication was being used for weight loss, what exactly led to this investigation, and the approval of Wegovy for the management of chronic weight. But now let's shift our focus into obesity management overall. We start off this section with a question: which health condition experienced the greatest increase among adults from 2010 to 2021? Would anyone like to take a guess? Obesity. That's correct. So from this time span, obesity increased by 58% compared to cancer, heart disease, stroke, and diabetes. This is WHO's definition of what's considered overweight and obese. They do separate it by category. So as adults, they have a separate category for children under 5 years of age, and also another category for children between 5 to 19 years old. So why is this important? So close to 60% was that increase based on the last question I just asked. And that's vital because obesity is now increasingly considered as a chronic disease by many medical associations worldwide. Obesity Canada is an organization that promotes advocacy for obesity management and works with healthcare partners around Canada to drive change by providing awareness that obesity is actually driven by biology, not a choice. It's treatable, it can impact health early on, and weight bias, stigma, and discrimination impact everyone. But when we look at a global scale as well, World Obesity Day falls on March 4th and is organized by the World Obesity Federation, working with members around the world. And the numbers there are just as staggering. 1.9 billion people around the world are estimated to be living with obesity in 2035. Childhood obesity alone is expected to increase by 100% between 2020 to 2035. And 4.32 trillion is the estimated global impact of being overweight and obese in 2035. But those numbers are staggering, but why is it important? Well, it's important because obesity is multifactorial. Not only is it being increasingly recognized as a chronic condition, but it's linked to your mental health as well, such as depression, anxiety, mechanical impacts such as obstructive sleep apnea, osteoarthritis, your metabolic health. So obesity is a risk factor for so many different conditions, type 2 diabetes, hypertension. And then as well as from an economic perspective, there's a lot of costs associated with it as well. But But what are these costs? So if we look at the healthcare system in Canada, we can see that $5.9 billion is the cost that's associated with 19 million additional physician visits and other healthcare and support needs. $8.2 billion is the economic losses from reduced workforce participation, and $3.8 billion is the reduced personal income among employed individuals with obesity. So we know medications like Wegovy are really effective for the management of obesity and overweight. We know there are significant costs that are associated with this condition. And we also know that it's multifactorial. It not only impacts your mental health, your physical health, it's a risk factor for so many different conditions. However, less than 20% of Canadians with private drug benefit plans have access to Health Canada approved obesity treatment medications. And what are these obesity treatment medications? Well, one is Wegovy, which we just covered. The other is Saxenda, which falls into the same class as Wegovy. And then we also have Contrast and Orlistat. We'll wrap up the presentation by addressing some frequently asked questions. So is weight loss sustainable long-term with Wegovy? So if we look back, Wegovy works by decreasing your appetite. It also slows gastric motility. But the studies was done with individuals taking part with the lifestyle measures, so such as exercise, diet, and physical activity. So it's important to maintain those same parameters to achieve that long-term weight loss. However, if we do decide to stop that medication, then those internal physiological mechanisms will be removed. So that decrease in appetite that the medication induced will no longer be present. The gastric emptying that it slows will no longer take effect. So if we return to those eating habits and the physical activity, then we are expected that weight will increase. What is microdosing Ozempic? So microdosing Ozempic is a trend that's recently started where individuals are taking lower than therapeutic doses on a weekly basis of Ozempic. This is based on some case reports that Ozempic has anti-inflammatory effects and also is neuroprotective, protecting against conditions such as Alzheimer's disease and Parkinson's disease. However, there's very limited studies that support this use or even these benefits, but individuals are still participating in it even though it's not recommended. However, when there was a shortage of Ozempic for patients with type 2 diabetes, American Diabetes Association put out a special report to provide suggestions of how to overcome these shortages. And one of the suggestions and strategies were actually individuals taking a lower than therapeutic weekly dose so that they can increase the duration of their pen to overcome that shortage. But again, it's not recommended, it's not safe practice to do so. What is Ozempic face? Well, this was a term that's actually coined by Dr. Paul Frank, a cosmetic dermatologist based out of the United States, when he had many patients on Ozempic come to his clinic with an appearance that was hollowed out. They showed increased signs of aging, such as lines and wrinkles, and they also had loose and sagging skin on their face. Of course, concerning, but was found that the weight loss, patients respond differently to it. Some individuals may experience much more drastic weight loss than others, especially around the face, which can lead to this presentation overall. Some management overall that can be done is decreasing the dose of Wegovy and then increasing the physical activity and lifestyle measures. Other individuals may opt out to continue on with their current dose of Wegovy, but decide to use fillers instead, dermatological fillers, to improve the appearance. And what are the costs that are associated with Ozempic and Wegovy treatments? Well, this is a screen graph from the ODB, Ontario Drug Benefit website. So Ozempic is covered for the treatment of type 2 diabetes if individuals fulfill the LU code 667, which essentially is a criteria that needs to be fulfilled in order to get the medication fully covered. If you don't fulfill with the criteria, then unfortunately you will have to pay about $250 a month. However, Novo Nordisk does have a single-use benefit card that can be used for Ozempic. On the other hand, Wegovy is not covered by the government. Some private insurance plans might cover it, but that can vary depending on the company. So the estimated cost is about $400 per package, which lasts about a month. That's the end of the presentation. Thank you so much for your time.